I'm going to demonstrate a hip flexion or hip flexion with abduction passive range hold. For a hip flexion passive range hold, I'm going to put my hand on a wall just for some balance. I'm going to pull the knee in toward the chest, achieving as great a depth of hip flexion as I can comfortably, meaning no pain. I'm going to start to squeeze the tissue between my thigh and my belly, as though I'm trying to squeeze a ball or a balloon and kind of pop that ball balloon right up here in that crease between hip and belly. So I'm in a deep position of hip flexion. I'm starting to squeeze that tissue. On the count of 3, I'm going to release. 1, 2, 3. And I'm attempting to maintain the height of hip flexion that I was able to move my leg into passively. So I'm holding this position, likely for about a 10 count, then release. Alternatively, we can add in a component of abduction, where we've moved the hip both into flexion, but also opening the hip out to the side. The stimulus is the same here. I will squeeze those muscles between my hip and belly, and on the count of 3, 1, 2, 3, move my hand away and resist a loss of hip flexion and abduction, holding this position up here for a 10 count and lowering down.